Do you take care of something that you hate? Well, we have a patient here, Michael, who for his whole life has hated his teeth. And what has happened, of course, is over the years, he has not been to a dentist since he was at school, and he has let his teeth go. And at this point, what has happened is that he has got a lot of decay and gum disease that's going on in his mouth. And I think this is a very common problem, because if there is something that you always look at every day in the mirror and it defines you and you're embarrassed, it causes a lot of pain and discomfort from infections or from the fact that bad bite and bad teeth can also cause migraines, the chances of taking care of the teeth is very low. And you can see from these photos that he has a lot of crowding. His main complaint was when his teeth came through, there were too many teeth for his mouth, and what's happened is now he's got rows of teeth. You can see on the bottom how the lower teeth are actually behind some of the front teeth. And of course, every time he talks or speaks or is in a photo, this is very noticeable. He also has what we call an overbite, which means that his front teeth are way forward, and he's very embarrassed by his teeth. He's also a very nervous patient. As a young patient, we always want to discuss all of the options that are possible. And one of the options would be to, of course, do gum treatment, to do orthodontic treatment, to do braces and possible jaw surgery in order to fix this. But after long discussions with him, he would like to start with a clean slate. He does not have any attachment to his teeth, and he understands that although a new set of teeth is very different from his natural teeth, or dental implants are very different from his natural teeth, this is the treatment that he has opted for. So you can see in this example how having crowded teeth, having teeth that are unhealthy, we're able to place the implants in a position that can give him a beautiful smile.